Well, there is certainly no doubt this has been a challenging time for children and families living with the pandemic for the past couple of years. And of course, we've been getting a lot of questions here about kids and their health and COVID, and it's all sort of tied into one. Joining us this morning is Dr. Dina, a pediatrician and the founder of Kid Crew. Dr. Kulik, thanks so much for joining us here because, we are sort of overwhelmed with a lot of questions regarding children. And, we've turned to you a lot in the past couple of years as the pandemic's been going on. I just wonder, in your practice lately, what are you seeing and what are you experiencing when it comes to COVID and kids?
Certainly, we're seeing a lot of cases, kids that are testing positive on rapid testing. Of course, some kids don't test positive but have classic symptoms or have parents or caregivers or teachers or friends at school that have known COVID and they have symptoms. It's really, as it always has been, the whole gamut of viral symptoms from fever to runny nose, sore throat, to vomiting, diarrhea, some kids that have belly pain. And most kids are doing really well. They really have throughout most of the pandemic. Certainly some children get sick, but by and large, kids have viral, flu-like symptoms and do quite well within a few days.
Okay, that's certainly reassuring indeed. We have several viewer questions I want to get through here. So let's start off with a question from Karen, Dr. Kulik. And Karen's asking this. My daughter is 11 years old. If she gets the COVID pediatric vaccine now, will it be mandatory to get another, quote, bigger dose at the age of 12?
It's a great question. It doesn't seem to matter per the guidelines, whether you've had a smaller, younger kid dose, as the viewer is stating. Once you turn 12, we should be giving the bigger kid dose. And that's just per guidelines. After 12, we get the adult dose, and before 12, we get the younger kid dose. Okay,
and it's interesting because I was going to follow up, but I'm looking at Janice's question here, which really does follow up nicely, Dr. Kulik, to that question. Janice says, my daughter stepped up and received her first and second doses as soon as she could. Now she's turning 12 later this month, and I'm not sure what the protocol is, as she will be eligible for a booster shot. So should she be getting a full shot along with 2 child doses? And this, you'll notice the theme here. A lot of people wondering about dosing children in that sort of on the cusp of the adult dose, as it were.
Yeah, so the booster dose for kids 11 and younger hasn't been released yet, but the booster dose for kids 12 and older would be given to any child that is then 12, regardless of what vaccine they received prior to that. If they were already 12 prior to that, they would get the same booster dose as we'd expect after 12. If they were 11 or younger at their first dose, once they turn 12, they would get the 12-year plus booster.
Dr. Kulik, this is a question for me. Considering the seasonality of COVID and what we've seen and what you just described in terms of what you're seeing in your practice in terms of children who fall sick with COVID and the kind of symptoms they deal with, let's say you have an 11-and-a-half-year-old or someone who's turning 12 in a couple of months' time. Would the recommendation be wait or vaccinate now with whatever dose you can get?
Yeah, it's a great question. I get this often. I think vaccinate now with whatever is offered now for your age, and whether that's Moderna or Pfizer or why not, get what you can get now. We want protection for as many people and children as possible now when you can.
Okay, that's good to clear that up. Let's get to another viewer question. This is Jacqueline. Jacqueline's asking, could the recent cases of hepatitis C in children be related to COVID or the vaccines? Are there any studies being done to show if this recent outbreak in children that are vaxxed or unvaxxed, type of vaccine received, and the age range? It's a long question here. She says, if so, is there a common link? And really, a lot of parents are wondering about this.
Yeah, and I'm glad that this is being asked because I'm asked this often and it is confusing. A lot of people think, well, it must be because of the COVID vaccine, but it absolutely cannot be, because many, many children in the cohort of the 200 kids or so that have been diagnosed with hepatitis were too young to receive a vaccine in any country. So kids from 1 month to 4 years of age have not received the vaccine, and yet some of the children with hepatitis have been diagnosed. And again, they were never vaccinated before. So we're not exactly sure what is triggering this hepatitis. We know it's not from the common hepatitis viruses, A, B, C, D, E, because these have been tested in these children and they're negative. Some children are testing positive for COVID. Some children probably had COVID previous, so maybe this is a form of long COVID, some people are speculating. And other kids have tested positive for a common non-hepatitis causing illness called adenovirus. We're not quite sure what the trigger is, but could it be, for example, previous COVID infection and now new adenovirus infection, for example? But it is not caused by the vaccine. Many of the kids have not been vaccinated that have been diagnosed with hepatitis.
Okay, Dr. Kulik, appreciate you clearing that up. And certainly our viewers do appreciate these answers from you. Hopefully we can get you back soon and talk more about that, because that, of course, is a crucial component to the COVID coverage. Have a great day, Dr. Kulik. Thanks so much.